now we have a lot of casualties and we have lack of resources, so we need to learn fast.
Вперше в Україні, я цього не побоюсь слова, дійсно вперше унікальний курс, який привезений американським товариством критичної медицини.
It's fascinating that all of these people, like 20 of them, were not afraid to come here.
Once we come into the hospital, the reality of everything just hit me.
Good morning, everyone.
We're going to talk about airway complications after surgical procedures.
Today in First Lviv Medical Union we have basically two courses. One is from fundamental critical care support, so basically students here learn how to manage critically ill patients and having a little bit of a discussion, and another one is for ICU Liberation.
Вона не реагує ні на що, правда?
Це negative 5 is correct.
Отже, -5 – це правильно.
On this course, such students as physical therapists and physicians learn how to manage their patients while they're in ICU, how to do early awakening and physical rehabilitation so that their patients can be healthier after they will be released from it. I'm a military doctor, so full escalation. I was in Donbass region.
Tidal volume, flow total.
Every doctor here is a great doctor, but we have lack of time, we have lack of resources, so probably we are not able to see small details, small pieces that we miss every day.
Okay, surgeons.
What we do is we provide the education to the experts here so then they can teach other healthcare providers in the rest of the country. It can help in any situation, as I said, where you need to quickly assess whether or not someone is seriously ill, recognizing the critically ill patient early so they can intervene and keep worse complications from happening. I think also they'll learn that the patients, if we control pain, if we control delirium, be able to get out of the intensive care quicker, that their families will have less stress, and that the working as a team is ultimately important. Every part of the team, including the patient and their families, is as equally as important and helps that patient move on, and thereby helps the society heal.
We see a lot of different cases in ICU every day because we have a lot of patients with blast injuries, patients who travel all over the Ukraine in different hospitals with very complex diagnosis, and we use all our multidisciplinary approach to help the patient. Patients has very complicated cases, a lot of organs and systems are injured, and so this is a big challenge for all of us in this way.
I think I'm amazed that there are so many young professionals who have finished their education in healthcare, either physicians or physiotherapists, and they're trying to adapt to the new realities of Ukraine and trying to do the best they can with the resources they have.
So it's a very elite team that has come here to help. We have pharmacists who basically lead many organizations of very complex systems. We have a respiratory therapist who leads not just his respiratory therapy division, but also helps manage ventilator development. We have physical therapists who teach physical therapy of ICU patients specifically all over the globe. The skills that are required are not just knowledge-based, but they're also practicing with their nursing colleagues, their physicians, other parts of the healthcare system to help patients come off the ventilator quickly, help them become more stable, help make sure that their needs are attended to, not just the medical, but also the social needs that might help move them through the maze of healthcare quickly.
Why it's important for Ukraine, for our physician at present time, because all know that we live in the war and in specific situation, and not all physicians have experience to treat critical trauma patients, multi-trauma patients, and early liberation from ICU, it's very important for health facility, for our physician.
Knowledge from this course is so important for us, and it will save a lot of lives in the future.
If we're talking about ICU liberation, so our patients will be, after this course, sedated,
easier, they will be extubated earlier, and they will feel better.
And then now we're going to practice a little bit of mobility. And then take a deep stretch. Drop your shoulder.
I know in what direction I should move. So for example, now I know how we should do rounds in the morning. And now I know how I should check each patient that I work with. For example, I also know how much non-pharmaceutical or non-invasive therapies like music and communication and all of this matter for patients. Please come more to Ukraine, and this is actually amazing what you do, and I do believe that we will implement all of this that you taught us, because we're actually doing this from this day and even from yesterday, because it's easy to do, but we just didn't know that it's possible.